So I'm going to share with you one of the main strategies that I utilize with my tootRN students who are preparing for the NCLEX or who just need some help with test taking strategies and trying to figure out what to do with these NCLEX style questions. So there are really 3 steps, and these are my 3 steps that I utilize through every single question, and I really just kind of bury into the brains of my students because this is something that's really going to be helpful to you when you're trying to work through these NCLEX style questions, whether it's really on your NCLEX or you're just taking a test in class. So step 1 is you need to identify what the question is asking you. So what is this question asking? So for instance, you might have this very long-winded question and you really want to be able to drill down to what the point of the question is. So as an example, let's say that your question says you've got a male client who has cirrhosis of the liver and the healthcare provider orders several different things for the patient. Which one of these things should the nurse question? Well, the question is really asking you, you have a patient with cirrhosis. What shouldn't we do? That's what the question is asking. So you always want to drill down to figure out what the problem is. That's what you're looking for. What's the problem in this question? What is it that I need to address? Then your second step is thinking about what the anticipated, so I'll put that anticipated, make sure we spell it right. What's anticipated or what is expected about or around this problem? So the problem in our example question was the person's got cirrhosis of the liver and we're looking for something we don't want to do. So what do I expect? What do I anticipate about this problem? The problem's the cirrhosis of the liver. So if the liver's not working, I'm thinking about all the things that I anticipate that are going to happen or that are going to occur. I'm thinking about my vitamin K. I'm thinking about protein. I'm thinking about fluid volume shifts. I'm thinking about the inability to metabolize medications. These are all the things I anticipate and I expect about this problem. So then my third step is now looking at my answer options, and I'm looking to see how those answer options align with what I anticipated and what the outcomes of that answer option or answer options are. So for instance, with the same scenario that we're utilizing as an example, if that patient has cirrhosis of the liver and I'm looking for what I don't want to do, that was my step 1. Step 2 was, okay, what do I anticipate about this problem? We listed out all the things we anticipate, problems with vitamin K, protein, fluid volume shifts, metabolism, right? So my third step is looking at the answer options and looking at each one to figure out which one aligns with what it is that I anticipated and what the problem itself is. So I'd be looking for something that has something to do with those problems that I identified, something to do with those anticipations and those expectations that I thought about. So let's say that there was something on there about barbiturate for the patient. Well, that's something that aligns to what I anticipated would be a problem, right? Because that's a problem with metabolism. I might want to question giving this patient a certain medication on a certain dose if their liver isn't working properly. And if the other options don't align with any of those anticipated or expected problems, then I'm able to kind of think through that. So the goal here is that you are carefully working your way through the question and you're critically thinking the whole entire time. And that's going to be super important, especially with higher level questions like applying or analyzing level, where you really do need to critically think. And remember, critical thinking is a combination of 2 things. Critical thinking is combining your knowledge, your nursing knowledge, everything it is that you've learned, right? Plus your nursing intuition. These things together equal critical thinking. And this is what you have to be able to do each and every time with the questions. So try out this 3-step strategy. Try to break it down in different parts to just make sure that you're identifying what the question's asking. What's the problem here? What do I anticipate or expect about the problem? And how do these answer options align to that? What is the outcome of the answer option? So if I pick A, what's going to happen? If I pick B, what's going to happen? If I pick C, what's going to happen? And how do those things fit in? So give it a try.